Hi, I'm Dr. David Tenner, and we are here at the Goldberg Clinic for chronic disease reversal, and we're here with Mr. Steve Husk. And Steve has been a patient of ours now for about 3 months. He came to see us back in May of 2015. Today is August the 12th. And Steve, what brought you in originally? What kind of problems have you been having, and what were they telling you medically when you went in for a medical workup?
Well, it actually started several years back. I was having joint pain all over my body. And the type of work that I had, that I've done all my life, I didn't think that was that unusual. But I started hurting in my low back a lot, and even up towards the front, and went to a multitude of doctors and had a multitude of tests done, bone density scans and x-rays, and I went to a lot of different places, blood work, everything you can think of, and nobody could figure it out until I finally went to a rheumatologist, and the rheumatologist diagnosed me with ankylosing spondylitis and immediately wanted to put me on Humira.
Okay, and ankylosing spondylitis is an autoimmune condition. It's an inflammatory autoimmune condition that affects the joints. Generally results in progressive stiffness, where the joints of the spine will start to fuse essentially, and the person loses a lot of their range of motion. It also comes with a lot of pain and disability. So Steve, when you were having those symptoms, what kind of functional impairments in terms of your ability to move have you been experiencing?
Well, I've always been pretty athletic all my life and very mobile. I work outside a lot, so it started, with wrist pain, elbow pain, and then in my back, and literally couldn't pick anything up off of the floor.
I remember when you came in, you couldn't bend over to pick up a pencil.
No,
yeah,
it's very difficult, and that's when that partnered with the fact that I was very tired all the time. Literally falling asleep at red lights.
Okay, so you were fatigued at the same time.
Very fatigued, especially after lunch and beyond. And that's my son kept pushing me to come here, and I put it off for over a year until I decided that mentally I'd had enough. And and plus, the fact that they wanted to put me on a medicine that can cause lymphoma didn't seem like a good idea to me, so I came here.
And Steve brings up a good point. A lot of the patients that are diagnosed with these kinds of autoimmune conditions, whether it's psoriatic arthritis, rheumatoid arthritis, ankylosing spondylitis, lupus, some of the more common drugs that are now prescribed for these problems fall into a category of what's called biological drugs, or TNF alpha blockers. The drug acts by interfering with TNF alpha, which is a portion of the immune system that helps to protect you against cancer. So one of the side effects and the things we'd be concerned about with patients on those drugs is in particular development of lymphoma, which we've seen other patients develop as a result of taking that medication. I actually just showed Steve a picture of a woman we have been working with who had a toxic response to taking Enbrel, which is a similar drug in the same category. What kind of things did that just describe the pictures?
Pretty horrific.
Yeah, she had a toxic response to the drug, and when she went to the hospital with a severe skin rash, they then put her on prednisone to suppress the rash. So, Steve came in to work with us, and of course you had low energy, you also had this joint pain and the stiffness going on. Your blood pressure was also high too.
Blood pressure, I've been on a blood pressure medication for 8 or 9 years.
8 or 9 years now, okay. So we had a number of things that we needed to work on. As we explained, Steve, describe to us what kind of changes you've noticed. It's now 60 days after you started a program with us.
Well, the first thing I noticed was after about the third week that my blood pressure had dropped drastically, and has progressively gotten to the point that it's better than normal.
And
if there's such a thing.
Are you taking any medication?
No medication.
So no medication, which you're on for 8 or 9 years with high blood pressure. Now your blood pressure is entirely normal. Excellent. Not just
check it 3 times a day, and it's very good.
And this is off medication.
Off medication.
So that's a really fantastic improvement. What else have you noticed?
My joints feel 100% better. No pain in the back, no real stiffness. I thought I had carpal tunnel, I thought for sure. In this hand, this wrist was hurting extremely bad. I couldn't do this at all. My elbows, really all over my body. So if anybody has this condition, they know what I'm referring to. I'm just 100% better. I mean, I really am. I've dropped 33 pounds. Wasn't even thinking about it, but my energy level has gone up unbelievably. I'm not tired. I don't even catch myself yawning. And when in the evening when I get home, I do the typical husband thing after we're done working all day, and I hit the recliner, and I'm still wide awake. So there's no excuse to not help out in the house. But yeah, the energy is so much better.
Steve's now drug-free, doing fantastic. Just about every goal that he set out to accomplish has been reached at this point. Now, at the same time, we told Steve that his body is still undergoing a lot of changes. This process of rebuilding him is still going to be going on for some months, probably a couple of years. So then he's going to have to be consistent in the kind of things that we have advised him on. But we'll be seeing Steve less and less over the course of time because in terms of working with us, it's also very much an educational process where we're teaching Steve the kind of things he needs to do so that he can start taking care of himself. Do you think we've done a good job with you in that?
I think so. I'm very happy with you and Dr. Goldberg, both of you. It's been very educational to me.